was a very good moment for us to first networking with new subject matters in the room, but also trying to learn from the core team from the University of Oslo, who are contributing on their basis to develop and improve DHIS2 features. So yeah, it was very a privilege for us to really understand and contribute. So we got information about the new features that are being developed, but also have contributed, but also people have showcased different use cases of how DHIS2 is being used to correct, store, and analyze data for decision making. My stay in the University of Oslo, it wasn't just only for a new conference, but I was there for three main purposes. The first one was a seminar on climate and health, where more than 10 countries, pilot countries, under the connection of University of Oslo, using the Wellcome Trust funds, we are implementing climate and health initiatives, where we are working on different models. For example, here in Rwanda, HISP Rwanda is working with the Ministry of Health to implement, test, train, and test this climate and health model, where we are having malaria use case, where for two purposes. One, we are translating climate indicators and malaria data to see how climate is affecting malaria indicators. Secondly, we are trying to come up with models that can help to predict what is going to happen in the future. And working with the malaria program and the Ministry of Health, we are trying to see how that model can help malaria program and the country to mitigate and to contain the increase of malaria in the country. So in University of Oslo, we have been able to showcase what we are doing and exchange with other 10 countries that are doing the same, but on different use cases. And we have been able to share, but also learn about through that climate and health seminar. Secondly, I have participated in annual conference. So in annual conference, I had two topics to share with the experts, global experts that were there. One was about, one of my session was about One Health. HISP Rwanda is contributing, where we are supporting the Ministry of Health through surveillance program to build a database, a system that is collecting the information on One Health, both wildlife animals, but also domestic animals. So we are collecting data using DHIS2. Of course, we are supporting that initiative. So we had a session to discuss with other subject experts globally that were there to see what they are doing, and also show how we are collaborating with the ministry and other experts to see how we can, the philosophy behind this One Health is that instead of just collecting data on disease, only human disease, we are now collecting data that will inform how environment, agriculture, and human, each is affecting another one. So we are trying to come up with translated data from animals, from agriculture, from environment, and humans, so that we can build the database that can contain all those data to help decision makers to understand that ecosystem, how one is affecting another, so that the interventions can be improved. So that was one of my sessions. Second session was about sharing how DHIS2 is contributing to manage logistics. The use case was for Comoros, where we are having this project where we are integrating DHIS2 and M Supply platform, so that we can help the country to manage supply chain, including vaccines and other commodities from central level to facilities. So that was also a very good, interesting session where I have partnering with my colleague from Comoros Ministry of Health to showcase that was in French. The first one was in English. Then the third one, I have participated in high-level Data Use and Triangulation Academy, which was facilitated by the experts from the University of Oslo. And we have been able to discuss how DHIS2 features can be used to support data use, but also triangulation. Triangulation, that means getting data from different sources so that you can put them together to understand the kind of scenario for you to base on something very tangible when it comes to decision making. So it is our task as e-health experts to understand how we can bring data from different sources so that we can come up with kind of insights or information that we can share with decision makers for them to decide based on tangible information that are meaningful. First thing is that when it comes to e-health and research in the context of health sector, one person is not enough to create an impact. So we need always to bring on board different subject matters with different backgrounds, with different experience, so that we can meet together and exchange, learn and share, and come up with some actions. Because this annual conference, we came up with some actions, and the next year we shall see if the recommendations that we shared to University of Oslo has been integrated and considered, but also whether the request from University of Oslo to the users of DHIS2 has also been respected. For example, the community, global community that is using DHIS2, were requested also to think how to support the core team from the University of Oslo, because DHIS2 is an open source, but it needs some funds to be operational so that the core team can create and maintain the features.
Sure.
So the community, the global community, the entire community using DHIS2 were requested also to go back and think how they can contribute to the operations of DHIS2. So it is our responsibility as HISP and UIO to maintain and provide the solutions and support solutions, but also the community is responsible to contribute financially, but also not financially, but mainly financially, but also contribute by suggesting some features so that DHIS2 can be operational and be sustained. In this world where the information is very key when it comes to decision making, when it comes to efficiency, when it comes to the use of resources, you need to have the real information for you to decide what to do. So DHIS2 is for me one of the key tools that are needed in our daily life. Not only health sector, because DHIS2 we are using it in education, we are using it in agriculture, we are using it even security, for example, where we are tracking the traffic accidents in different countries, in the climate health. So you understand that DHIS2 is a backbone of the planning, monitoring, and evaluation. Because without the DHIS2, in the context of health sector where it is being used, people they won't be having data. Secondly, it is a digital public good. That means there's no license for a user to be able to use it. Third, I got the insight from DHIS2 comparing to other digital solutions, because DHIS2 has a secret behind how it is being developed. It is being developed in 3 cycles. The third one, we have a core part that is being maintained by the University of Oslo. That core is the main part of DHIS2, and it is not changed by the user's feedback. But there is a second cycle which is a customizable part of the DHIS2. That is very key to me, because it gives flexibility to users for them to be able to adapt and customize their own solutions depending on their use cases using that customizable part. The third part is that DHIS2 offers that flexibility of developing new features if you need more that is not being maybe given by DHIS2 current versions we have. So that part, that third cycle where you can develop your DHIS2 app and integrate it in your DHIS2 and be able to serve your purpose, it's also very key to me. And those three cycles or three layers gives me the right to call it like maybe the best emerald. It's not even a single DPG, it's a multi-digital public good, because it offers all those flexibilities. It's not just a single DPG, it's a multi-DPG. And this DHIS2 is mostly serving the purpose in the low-income countries, because maybe the countries with very stable income, they have those expensive platforms. But when it comes to low-income countries, DHIS2 is serving as the backbone of the development when it comes to collection, storing, and analysis of data for decision making.